Alright, let's go over the medical decision making part of the chart. So I am in this patient's chart. I just opened it up. I've already done the chart up into the medical decision making. This is like a abdominal pain patient. So first thing you'll see is the differential. You're going to see how you can put in your orders right here, EKG, your results, and any imaging. So for the differential, you basically just click through. It's going to populate it based on the type of chart you opened. So abdominal pain obviously is going to have a bunch of abdominal stuff. If you opened a general medical chart, it's going to be some general stuff. So you might need to click other and free text what you need. So with this patient, I'm just going to click a few different differentials here. And then for your billing part, it's always good to document anything that you reviewed. And you want to be specific and say what you actually reviewed. So I usually will kind of hover over to the list and see if they've been here before. And so I can see they were here for hand injury in September 2015. So I'm going to write that I reviewed prior ED, prior records. And you can't just click those, you need to type what you reviewed. So ED note 9 2015 for hand injury. That will increase your billing, so I don't have to type this every time. I've made a little macro that said reviewed chart, reviewed ED note, and then I can just type what date, but I didn't use that so I could show you how to do it. The next thing you want to do in your medical decision making is input your orders. So it's best to wait until you're pretty much done with the patient so that all your orders will be up to date. It's not going to keep inputting your orders, updating them if you add a pain medicine or something. So the way you input your orders is you skip this launch orders part and you go to review insert order profile. You click on it and you're going to see all the orders done. And all you have to do is hit include displayed and it's going to put all this in the note. So let me show you. So now it's showing, the CAT scan, the CBC, the pain meds I gave. I'm going to erase this real quick. So again, you go to review insert order profile. Now sometimes there's going to be a bunch of other stuff on there that you didn't order. If the patient has an MRI scheduled, a mammogram, physical therapy, it's going to show all this stuff because you want to make sure that your display is on all orders, all statuses. I'm sorry I should have said that at the beginning, but when you go up here for orders, there's different filters. You always want to make sure it's on all order, all statuses. So things are going to, unless if you don't do that, then things are going to be left out. So if there is a bunch of junk in here that you don't want in your note, instead of hitting include displayed, you can go through and just select what you want, by holding control and going through going through and select your items, then you can just hit include selected. Then it's just going to put those items right here. So with this patient, it's just ER stuff, so I'm going to go to review, insert order profile. I need to make sure this is on all order, all statuses, and it'll leave it at that as long as you don't mess with it. Then I'm going to do include displayed. So we'll go down. If you want to put the monitor, you can. For an EKG, it's pretty self-explanatory. You're just going to click on the time. Make sure you want to put the exact time that's on the EKG. And if you're, have a patient that's around midnight, make sure that you put the right date. If you're charting after midnight but it's done at 11:30, make sure you go down a day. And then you can fill in the rate. And then you can just go through and click a normal, or you can, do ST segment non specific. You can click that over here, or you can hit other and type in your findings, but pretty much everything is right there to click through. For the results, the lab results, it's pretty much the same thing as inputting them. So you're going to hit lab results, and you can see all the results. And then all you have to do from here is hit select all. It's going to highlight everything, and then include selected, and that inputs everything over. So I'm going to clear it by right-clicking over results review and hitting clear. I'm just going to show again. So all results, looks about the same, but you're going to have stuff from prior visits that they were here. So I'm going to hit lab results, select all, include selected.
Oh, I was supposed to say 11.
And then for the x-rays or radiology findings, if they have a chest x-ray, you can hit no acute disease process and, click your interpretation that you interpreted it, or you can hit describe and do it yourself, just free text it. Or if you hit these double arrows, it'll give you some options to just kind of click. Same thing for CTs. This is bringing up kind of common stuff for this type of template, abdominal pain. For a CT, you can hit CT, the body location. You can just type it in here. And then you can hit if it's with or without contrast. They reviewed the report. And you can put if it's negative, or you could free text the report. Or you can copy and paste the radiology report. So at night we're at Desert Radiology, so you would have to open up the Desert Radiology browser and in a different window and log in and search for the patient, and then you just select the report and right click and copy and paste it over. If it's during the day or one of our radiologists read it, you can get the report two different ways. If you see this launch rad interpretation, we can open this up and copy and paste. Sometimes, for some reason, some CAT scans or x-rays don't have that. In that case, you go over to the bar over here, imaging, and you'll copy and paste the result. So I'm not seeing anything on her. Let's see if there's anything in the past that I can just give you an example of. Okay, so let's pretend like this would have popped up for today. So we went to imaging. I would just double click the imaging and highlight it, Control C, X out of it. I'm going to go back to documentation, and then I'll just hit other, right click, and paste it in. You would think there's a way with Cerner to just for it to automatically come up, but there isn't. So if I was to do it from this launch rad flow sheet, it'd be the same thing. I'll just double click it. Right now I'm changing the search criteria to look for an older one, but if it was done today and resulted today, it would just be right here. Right click, change search criteria just to have something to put in. Open it up. Control C. Get out of this stuff. Hit other and paste it in. So basically you're going to be doing some kind of pasting the results in. Or you can type it. So that's the, basically going through what we did in the ER. This is very important to get everything in because that's where we get our billing from. I'm at work right now, so I'm going to make sure there's no one I need to see, Real quick, I'm going to put in some pain medicine for a patient. You guys should know how to do this. This is just for someone that the nurse came and asked me to give pain meds to. Okay, so back to our medical decision making. The next most important part is going to be the re-exams and re-evals. So right under MDMs is your re-evals. You always want to have a couple of re-evals if they've been here a while. So if you open up the re-eval section, you'll see that you could put in your vital signs if you wanted to put in repeat vital signs. You could you can just click if they're improving or worsening or if they're unchanged. You could comment on their pain right here. There's always an other section if you want a free text. Or you could just write in the notes. That's what I usually do, is just go for here are the notes and say what's going on with the patient or if I talked with them. I've also made a macro, which you'll probably do, just a common reeval macro. I've got a lot of them actually. So for like a chest pain patient, you might say that you gave them aspirin and serial exams, no recurrent pain. That's just something I wrote one day in notes, and right click, save macro as, and title it what you want. So now every time I have a chest pain patient, I don't have to go in and type that. I'll just open it, go to my macros, and there's my reeval. Serial exam, stable, no deterioration. Something I right-clicked in the past, or something I typed out in the past, and can now use. So let's say you want to put multiple reevals. What you do is you go to the re-exam, reeval part right here. You hover over it, and you right-click. Remember I said that right-click gets you through a lot in Cerner. Right-click, and you hit repeat. And then you can do another reeval. You can do that as many times as you need. Same goes up here for CAT scans, and let's see. I want to get in this section of the medical decision making. So as you can see, since I'm out of it, all the icons for me to do stuff is gone. So I'm going to click on medical decision making. It's changed it now. Let's say I did a couple different CAT scans. I needed another one. I would just right click over the part that I need, the radiology results, and hit repeat. If there was another EKG that I needed to document, I would right click over EKG, because that's what I need another section of, and repeat. So that's your medical decision making section. A couple of quick notes on strokes. We have to put a reason why the patient is not getting TPA, even if it's self-explanatory, even if it's a TIA and everything's resolved, even if it's a head bleed and it's obvious that we can't give TPA because they're bleeding. Because of stroke center requirements, we have to put why they're not getting TPA. The best place to do that would be under the rationale. You can just type out no TPA given due to, and then XYZ. It's usually no TPA is given due to, it's been too long since the symptoms started, so I saved a macro that said no TPA due to patient out of window, symptoms greater than 4.5 hours. So you could make a macro like that, or you could type it for whatever the reason is every time. It's up to you. On chest pain patients, you have to have a TIMI score. By the time you're doing this orientation, it will probably be moved on to the heart score. So I'm going to look for a chest pain patient. Nope. Open it up. And you can see for the chest pain notes, under the rationale, they already have the TIMI here. This will soon be changed into heart, but basically just remember on any chest pain patient to fill out a TIMI or a heart score depending on what's here. That kind of brings up a good teaching point, is what if you need to go back in and correct a note. I've already signed this note. That's why it's green. Red means it hasn't been opened, yellow means it's pending, you haven't signed it, and green means it's signed. So if I need to get back in this note, I'm going to click on documentation and double click. And you always want to hit correct note. Modifying notes is going to leave a little section at the bottom where you can make just like a one sentence addendum. But if you correct note, it's just going to let you back in your note, and you can change whatever you need. And then it'll timestamp at the bottom that that you went in the note. So I'm going to cancel out of this. And let me see if there's anything else I should go over. I think we can do procedures now. So Procedures can be time consuming on this. Let's go down to the procedure section over here. Critical care is pretty self-explanatory. You're going to click how many minutes, and then you have to also, even though we know 31 minutes is in between 30 and 74, we have to also hit this. And then you just kind of click on some stuff to fluff it up. So critical care is easy, and that's on every note. To do actual procedures, you have to right click over procedure. And then you hit insert sentence. So not intuitive at all. And then you'll see all the different procedures. Anything from endotracheal intubation to laceration repair. So if you did multiple procedures on one patient, you want to click them when you're going through it. So let's say I did a intubation and a lac. So I'm going to hit OK now. So I've clicked the procedures I want to put in. Now you can see in a procedure you got your endotracheal intubation and your laceration, and we'll fill them in. But if there's something you forgot, you could just go over to procedure again, right click, insert sentence, and choose what you need. So we'll go through a couple of examples. For the intubation, you just fill out what you need and what you know. So you always say that no consent was emergent. You confirm stuff. Your airway assessment. You can type in your meds here. You can put rocuronium and etomidate, whatever you want. You just click through these little. I guess these little dashes means you type a number in. So we use an 802 curved blade, secured at 22. Doing the actual procedure documentation is pretty easy. It's just knowing to remember to right click, insert sentence, and then go through it. For lacerations, same thing. You're confirmed, correct, your consent. And you want to always fill in the length of the laceration. You want to put where it's at. You can, if you hit face or any of these with a plus, it's going to give you more options to choose from. If you don't want to be searching for stuff, then you can always just free text it under location. You're going to do the description here, like the depth, if it's clean, how much anesthesia you used. And then you'll put in your actual sutures here and what kind. Now, if you did multiple repairs, you need this done a couple times. You go over description, the part that you need to duplicate. You're going to right click and repeat. That just populated this again, so you could do your other laceration. And then just fill in the rest. So that's it for procedures. Even with procedures, you can save favorites. So I'm going to clear out of this. If I needed to clear everything out, if I mess it up, you right click on what you need cleared out and hit clear. So I usually use an 8.0, use rocuronium, and do rapid sequence. So instead of, kept clicking through that multiple times, one time when I had it all filled out the way I liked it, I right clicked over endotracheal intubation and I went to save macro as. And so now you can see the M next to endotracheal intubation means that I've got a macro. So here is what I had saved. And so now I don't have to go through and type all that out every time or click it all out. It's got everything that I normally do. And if I change something, if I'd used a 7.5, I know I just have to go in here and change it to 7.5, but still saved me a ton of typing. So don't forget, anything you can do in Cerner, you can make a favorite out of. And for procedures, you go to procedure, right click, insert sentence, figure out what you need.